attentional physiotherapists, chiropractors, and osteopaths. Do you see patients with neck injuries like whiplash and chronic neck pain? And they also complain of other symptoms like blurred vision, poor posture, brain fog, fatigue, dizziness, nausea, amongst many other things. And I'm sure if you've been in practice for more than a week, and people have come to you complaining of chronic neck issues or a traumatic neck issue like a sporting injury or a whiplash injury, most of these symptoms will be very familiar to you. Do you know why this happens? Do you know why many of these patients with neck problems present with these additional symptoms? Do you provide assessment to the vestibular, oculomotor, autonomics, and balance systems when assessing people with chronic neck problems? If not, then you're more than likely missing many causes to their problems and opportunities to get patients better. Hopefully this has intrigued you to know a little bit more about our upcoming series, NeuroConnect. NeuroConnect is a 4-part series that's aimed at clinicians to upskill their knowledge and get better patient results in many neuromusculoskeletal conditions. It's a 4-part series kicking in March 2019. So the first module is all about the clinical foundations, all about the connections, and I'm going to be touching a little bit about that in this video. Module 2 is all about the assessment, how to put that information together into a very efficient and effective assessment system. And then modules 3 and 4 are all about the main conditions that we see. They're either spinal-based or they're pain-based. And there's obviously an overlap there. So we're going to bring you up to date with many of the latest evidence, the clinical applications, and the knowledge for you to be better at what you do and get better patient results. So I'm going to touch on, in this instance, the conditions that relate to the spine and how they affect the brain. They're not distinct. We see it in practice, but why does it happen? And one of the best examples to see this is in the whiplash arena, where a lot of the research is shown. And allow me to demonstrate here on with this slide. So in this instance, if we have a neck that say it's not working well, altered input, so the afferents or the sensory information that's coming from the neck has been disturbed. And it's either been disturbed through trauma, ischemic issues, inflammatory problems, altered neuromuscular control, so a neck joint system that's not working well, the muscles are not controlling the neck, or morphological changes like arthritis. We can have pain and stressful conditions. All these will change the sensitivity and function and the feedback from the neck to the brain. Now, it doesn't just go there. It also then flows onto our visual system. It flows onto our vestibular system. It flows onto our higher cortical systems. So we get things like visual instability. We get blurred vision. We get difficulty reading. We can get dizziness. We can get lightheadedness sometimes. We get poor body awareness. We get stress. We get brain fog. We get poor sleep quality. These all are attributed to altered input that comes from the neck through whichever process, injury, repetitive strain, like poor posture at a computer desk, and it has flow-on effects to other areas. So this is one of many sort of visual charts that we use in our lecture that talks about when something's wrong with the spine, it's going to have a flow-on effect to other areas. Now, how cool would that be to be able to explain this to patients in a very efficient and modern way? We need to move away some of the archaic ways of explaining when a spine is in dysfunction, this is what happens. So I want to bring you up to speed with that. So ultimately, all this information is good, but in the end, I want you to get better patient results. I want you to be able to retain patients. I want you to be the person that they refer to. I want you to be the go-to person that they say, go see my chiro, osteo, or physio, because this guy knows what they're talking about. They've explained it to me in a way that no one else has. All right? And obviously communication is really important. Because remember, without knowledge, what you see is just seeing. An observation is a skill that needs to be acquired. And that knowledge comes from the information that we're going to present. All right? Our seminar is going to be held within a purpose-built clinic in the center of Hong Kong. This clinic has got multiple rooms, so we can do practicals on tables. It's got neuro rehab equipment that we can both assess and use to manage patients. And you'll get a first-hand impression of what it looks like to run a practice along these lines. And also, because it's a clinic, we have to limit the numbers to 20 people only. So get in now. Once these 20 people sell, that's it. These 20 spots fill. So get in now. We've got some great early bird prices, very early bird prices before the end of the year. Secure it now, otherwise prices will go up in the new year, which even that is still great value, but take advantage of it now. And to save a few more dollars, Hong Kong dollars that is, I'd encourage you to consider registering for all four events. And you can do so again by securing at very early prices. So go to www.brainhubacademia and .com.au, and you'll be able to secure these prices and secure a spot right now. Talk to you soon. Bye-bye.